Alright, so the first thing that I would do is I would check my doctor's order. Our doctor has ordered the patient to have 0.5 milliliters of sterile water. And first thing I would do is wash my hands, and then I would go gather my supplies. So my supplies include a alcohol prep, a vial of sterile water, and since the dosage is less than 1 milliliter, I would be using a 1 milliliter syringe. Alright, so next thing that I would do is I would take out the alcohol prep and prep the outside of the bottle with the alcohol. Let that dry, do not fan it, do not blow on it, anything like that, just let it dry on its own. And then while that is drying, I would take out my 1 milliliter syringe and take in 0.05 milliliters of air. Once my vial has dried, I would take my needle and inject 0.5 milliliters of air. Alright, and then I would take in 0.5 milliliters of sterile water, and I would have another nurse check me. That's part of the 6 rights. Correct. Alright. So since I had another nurse check me, I would take the needle out of the vial. I would have another needle prepped and ready to go so I could take off the needle and replace it with a new one. I would not recap this needle. It's too blunt to give the patient. So I would take my dosage with me. I would knock on the patient's door, introduce myself, make sure I have the right patient, make sure it's the right time, and make sure I have the right route, which is subcutaneously injecting 0.5 milliliters of sterile water. So I would grab my gloves after letting the patient see me wash my hands. All right. So I would go ahead making sure again that I have 0.5 milliliters of sterile water. I would grab another alcohol prep and tell the patient I'm going to now swab your arm for 30 seconds, and I'm going to use friction and start inner to outer. I'm going to go ahead and dispose of that. And you do not want to fan this, you just want to let it dry on its own. So it is dried on its own. So I would grab any part of the patient's fatty tissue, you don't call it fatty, and I would go in with my bevel up at a 45 to a 90 degree angle depending on how husky your patient is. This patient's not very husky, so I'm going to go in at a 45 degree angle and warn them, 1, 2, 3, stick, inject my sterile water, and immediately dispose the syringe into a sharps container. Now, once I have done that, I will not recap the needle at all. I would take off my gloves, again wash my hands, and turn around and document everything that's part of the 6 rights. Document how well the procedure went with the patient, that I injected 0.5 milliliters of sterile water into the patient subcutaneously using a 25 gauge needle and how long the needle was. I would also say, if I wasted any part of the sterile water or if I had to dispose of another needle, I would document that as well. So that's about everything, I think.